Hi, I'm Dr. Jeff Langmaid, and you're watching Research That Matters TV. Tennis elbow isn't just for athletes. Lateral epicondylitis, known as tennis elbow, is a painful condition that occurs when the tendons in your elbow are inflamed and overloaded due to repetitive motion. Because of the motion that occurs when swinging a racket, it's commonly referred to as tennis elbow, but anyone who has a job that features repetitive arm motions may be at risk. Tennis elbow can become a serious issue because of the pain and weakness that make it difficult to perform your daily tasks. Because it's an injury caused by repetitive motions, and since many of these motions are essential to job functions, finding ways to decrease the inflammation and improve your biomechanics is absolutely critical. 3 ways to find natural relief from pain associated with tennis elbow include: number 1, rest. Give your arm time to rest. It's so important to stop the cascade of inflammation and pain. Ice. Icing a few times per hour is a smart strategy to reduce pain and inflammation if your elbow's acting up. And technique. Be mindful of how you're moving your arm. Use proper ergonomics and use a brace for a short time if necessary. Tennis elbow is usually not a condition that'll go away on its own. However, we've found that 2 key strategies for reducing the pain associated with tennis elbow. First is to receive a plan of care that includes at-home exercises to strengthen the supporting muscles. And second is receiving adjustments when necessary to improve the motion and movement of your elbow joint. And if you or someone you know has struggled with tennis elbow, give us a call so we can provide them or you with a plan to find relief. My name is Dr. Jeff Langmaid, and I'll see you next week for another episode of Research That Matters TV.